All right, it looks like our numbers are holding pretty steady, so I'm going to go ahead and get us started. Good morning and good afternoon, depending on where you are. Thank you so much for joining us for this webinar today. I'm Ruth Friedman. I'm the Director of the Office of Child Care in the Administration for Children and Families at the U.S. Department of Health and Human Services. I'm really happy to be here with you to talk about our notice of proposed rulemaking for the Federal Child Care Program, the Child Care and Development Fund, or CCDF. This webinar today is specifically focused on how the NPRM impacts the CCDF tribal program and is one of the ways we are engaging the public in the proposed rule. The Biden-Harris administration is committed to creating partnerships with tribal nations that appropriately honor the nation-to-nation relationship. We will also be holding a tribal consultation on this NPRM next Thursday on July 20th. Tribal leaders received a notice about this consultation a couple weeks ago, and we will share the registration link for that consultation at the end of this call again. In just a few minutes, we're going to be joined by Megan Campbell. She's an invaluable member of our great team here at the Office of Child Care. And together we're going to present highlights of the proposed rule and talk about how you can submit comments. I know you join me in recognizing that childcare is a necessity for families with young children. Without it, parents can't go to work, they can't go to school or get job training they need, and frankly, sometimes they can't get the respite that they need for their own health and mental health. That's why reliable access to childcare increases parents' earnings, their education, their employment, their well-being. Yet most families struggle to find affordable, high-quality care that meets their needs. Childcare is simply too expensive in most areas, and in many communities, there just isn't enough to meet the need of families. And yet, at the same time, childcare programs barely make enough to keep their doors open, and the sector relies on an incredible and dedicated childcare workforce that receives little compensation for the essential work that they do. We frequently hear stories about childcare programs losing staff or having trouble finding staff because people can make more money doing other jobs. Yet the work that childcare providers do is so vital to our children's development. It's vital to parents' employment, and it is a driver of the economic engine of our communities. That's why the Biden-Harris administration, the budget included major new investments in childcare so that every family in America can find and afford the childcare they need. And that's why the president announced an executive order this past April on increasing access to high-quality care and supporting caregivers. This NPRM that we're going to discuss today builds on that executive order by making key proposals to strengthen our very important current federal program, the Child Care and Development Fund, for the 1.5 million children it serves and the 230,000 child care providers that participate. So I do want to be clear that the proposed rules we will be talking about today are focused solely on the Child Care and Development Fund program and the families and providers participating in that program. It is an $11.5 billion federal program to state, territory, and tribal governments, but specifically to tribal lead agencies, it's a little over $500 million and actually serves well over 17,000 Native children through those tribal lead agency programs. Tribes can also use CCDF funds for child care construction and major renovation. I've had the pleasure of touring some really wonderful tribally operated child care facilities built with CCDF funds. And this is a really important flexibility in the law for tribal nations. The goals of the NPRM we're discussing today are to lower childcare costs for families receiving CCDF, to increase families' childcare options so they're more likely to access the childcare they need, to strengthen the payment practices we're using to support providers and help stabilize their operations, and to encourage some more family-friendly practices that will make program enrollment easier and faster for families. In addition, we also propose to increase the flexibility for tribal construction and major renovation so there is more time to spend the funds. We believe that when enacted, the proposals in this NPRM will mean more families will be able to find and afford care that meets their needs. Families will have better economic stability. More children will be in higher quality childcare that supports their development and helps sets them on a more positive track in life. And providers in the program will receive fairer and more stable support for the essential and important work that they do for our children, families, and communities. And with that, I'm going to turn it over to Megan.
Thanks, Ruth. Hi, everybody. I'm Megan Campbell. I'm a child care policy supervisor in the Office of Child Care. And before we dive into the details of the NPRM, we want to provide some general background on NPRMs for those of you who may not be familiar. When the federal government wants to make new program rules or change existing rules, they have to first publish them in the Federal Register and seek public comment. So our proposed program rules went live on regulations.gov on Tuesday for viewing and were officially published yesterday on the same website. There you will find the proposed changes and the reasons behind the proposals. The public will have 45 days to submit comments about the proposed changes. That means comments are open through August 28th, 2023. As Ruth mentioned, tribal consultation is scheduled for July 20th, next Thursday. We know the consultation timeline is very quick, but we must complete consultation during the 45-day public comment period. After the public comment period, the Office of Child Care and the Administration for Children and Families will review all comments and work to issue final regulations that will then be enacted by state, tribal, and territory governments. I do want to note that we are not permitted to answer questions about the NPRM that are not directly addressed in the NPRM. I know that can seem frustrating, particularly for our tribal lead agencies, states, and territories, but that want to speak with their Office of Child Care Program Specialists about the NPRM. But federal rules prohibit it because it gives some parties more information than others, and we want to ensure an equal opportunity to comment. It's also why the chat feature isn't on today. We will have more information on how to provide comments at the end of this webinar, and you will also find instructions on how to submit comments on these proposals in the NPRM itself. And now I'll turn it back to Ruth.
Thanks, Megan. As I previously mentioned, it is a priority for this administration to lower the cost of childcare for families. We know that high childcare costs can mean families have to choose between necessities, and that high childcare costs can force parents to reduce work hours or leave the workforce altogether. Even for families participating in CCDF or wanting to participate in CCDF, family co-payments can be a real financial strain that harms their economic well-being, family stability, and can be a barrier to participating at all. So we have a couple of key proposals that Megan is going to walk you through to lower the cost of childcare for families participating in the tribal CCDF program.
Thanks. So first, the NPRM proposes to allow tribes to waive all family co-payments for families participating in CCDF. This is a major difference between the NPRM for states and territories and the NPRM for tribes. So we want to be sure that this proposed new flexibility is clear. Under CCDF, payment to providers is a combination of a tribal CCDF payment plus a parent co-payment. Tribes have flexibility in setting how much parents pay, but right now, CCDF requires tribes with medium and large CCDF allocations, so those that received more than $250,000 in CCDF funding in federal fiscal year 2016, to have co-payments for at least some families participating in the subsidy program. Tribes with small CCDF allocations, those that received less than $250,000 in FY 2016, already have the flexibility to waive co-payments for all families. We are not proposing to change that. Rather, this NPRM proposes to make it so that every tribal lead agency has the flexibility to have zero copays for all families receiving CCDF assistance. The total amount going to the provider would not decrease, but tribes could shift all of the costs from families to the federal CCDF funds if they chose to. For tribes who don't choose to waive copays for all families, the NPRM proposes to cap parent copayments at 7% of family income, which aligns with the maximum affordability benchmark HHS set for copays in 2016. As I mentioned in the last slide, the CCDF payment to providers is a combination of the payment from the tribe plus the parent copayment. Tribes continue to have flexibility in how much parents pay, but the law prohibits parent copayments that would be a barrier to childcare access. So like with the last proposal, the total amount going to the provider would not decrease with this proposal, but would lower costs for parents benefiting from CCDF and shifting more of the costs from families to the federal CCDF program.
So moving on to our next set of proposals, these are aimed at strengthening the payment rates and practices tribal programs use to pay participating childcare providers. We believe strengthening these policies for childcare providers will help stabilize their operations, make it easier for more providers to accept families with subsidies, and provide more options and choice for families participating in the CCDF program. As I mentioned before, we know the availability of affordable, high-quality care that meets families' needs continues to lag well behind the demand, and this can make it really hard for families to find the care they need and they want. Childcare is incredibly labor-intensive, and parents simply can't afford to cover the true cost of care. Supporting parent choice, meaning making sure parents have the options that meet their needs, is a central piece of the CCDF law. But because of the lack of childcare supply in this country, we really don't see a reality in terms of parent choice. And so we think this is at a situation, the situation is at a point where we want to act and make sure that CCDF policies are designed to support parent choice and make sure that providers are have their operations stabilized and that the policies are properly supporting them. And so that's what these next set of proposals are meant to do.
So this NPRM proposes to require tribes with medium and large CCDF allocations to ensure timely provider payments by paying prospectively, meaning at the beginning of the delivery of child care services. This requirement does not apply to tribes with small allocations. In most of the private pay market, families have to pay at the beginning of the week or the month because providers need to receive payment before services are delivered in order to meet payroll and pay rent. CCDF requires tribes with medium and large allocations to use generally accepted payment practices, but many are still paying providers weeks after services begin. This is extremely destabilizing to childcare providers and makes it difficult for them to accept subsidy payments from families. It creates an upfront burden from providers and is often reported as a key reason why they will not participate in the CCDF program. Ultimately, slow payment practices keep families from having access to the childcare choices and options they need. So the NPRM requires tribal CCDF programs with medium and large allocations to make prospective subsidy payments to childcare providers to make sure they are paid in a way that allows them to cover their costs. The NPRM also includes a proposal to require tribal CCDF programs with medium and large allocations to use enrollment-based payment instead of attendance-based payments. This does not apply to tribes with small allocations. The fixed costs of providing childcare, including staff wages, rent, and utilities, do not decrease if a child is absent. That's why private pay families are generally required to pay for a full week or month, regardless of whether their enrolled child is absent. Providers that get paid by CCDF programs based on attendance either absorb the lost revenue associated with occasional absences or choose not to participate in the subsidy system at all. CCDF requires tribes with medium and large allocations to support the fixed costs of providing childcare services by delinking provider payments for a child's occasional absences, but the current rules simply do not do enough to ensure stable childcare operations and for parents to have childcare options to meet their needs. CCDF requires tribes with large CCDF medium and large CCDF allocations to set payment rates for providers that allow families participating in CCDF to have equal access to childcare as families who do not receive subsidies. This requirement does not apply to tribes with small allocations. CCDF permits all tribes to pay providers at this full established rate, even if it is more than the rate the childcare provider charges. This is an extremely important principle in childcare policy because the price of childcare is dictated by what parents are able to afford, not the true cost of providing childcare, which is higher than most families can pay. This broken market system undermines provider stability, dampens childcare supply, constrains childcare wages, and can make high-quality care out of reach for many families. This disconnect between the price of childcare for families and the cost of providing childcare is one reason the Office of Child Care has previously instructed CCDF lead agencies that they are allowed to use CCDF funds to pay providers the tribe's full established rate, even if that rate is higher than what parents in their communities can afford. Because of the importance of that policy for meeting the needs of children and families and supporting the stability and quality of childcare providers, this NPRM proposes to make clear in the regulations that this is an allowable use of CCDF funds and strongly encouraged.
Thanks, Megan. The last, well, we have two more sets of proposals to talk about today in this NPRM. This set of proposals is meant to make it easier and faster for families to enroll in tribal child care subsidy programs. But before I explain these proposals, I do want to note that more and more tribes have been shifting to take advantage of the flexibility for categorical eligibility in CCDF. It's a really important flexibility, which allows faster benefits and less paperwork. These proposals that I'm about to mention here, they are not relevant for tribes who either cannot or do not use categorical eligibility policies. Those sorts of policies really already try to take care of what we are aiming to do with these policies. And if you are not familiar with categorical eligibility policies in the tribal CCDF program, I do highly recommend that you reach out to your program specialist at the Office of Child Care, and they can tell you more about it. But for tribes who are not using categorical eligibility policies, we want to make enrollment easier. We know that families miss out on benefits because of administrative challenges rather than eligibility issues, and we want to try to help eliminate this problem. Enrollment delays can lead to families being forced to turn down or delay jobs or education, and we don't want the bureaucracy to stand in the way of parent employment or family well-being. So for that reason, we are proposing to make it easier for tribes to use presumptive eligibility policies in CCDF. The NPRM would allow tribes to consider a child presumptively eligible for subsidy prior to the full documentation and verification of the tribe's eligibility criteria and determination. To be presumptively eligible, a child must be plausibly assumed by the tribe to meet each of the basic federal requirements. Tribes would have the flexibility to collect minimal information to determine eligibility presumptively and get subsidy going to the family. And except in cases of fraud or intentional program violation, we are proposing that tribes could use federal CCDF funds for up to 3 months, even if the child was ultimately determined to be ineligible. We believe this proposal will help make sure that parents don't miss out on job opportunities because of lack of childcare. The NPRM also aims to lessen the burden of administrative requirements on families applying for child care assistance by requiring tribes to use family-friendly enrollment practices, meaning practices that do not disrupt parent employment, education, or training opportunities. Parents report to us that some of the biggest challenges in this program are long waits at inconvenient times to apply in person or gathering the necessary documents. So the NPRM encourages tribes to simplify enrollment by using a family's enrollment in other public benefit programs or using documents or verification from other programs in order to verify eligibility for CCDF. It also encourages tribes to offer online subsidy applications. We think these sorts of practices could make a big difference for families needing childcare assistance.
The NPRM includes a couple key changes to the rules around tribal construction that I want to highlight. First, we propose to change the definition of major renovation to be based on cost and not based on a description of structural change. The current definition for major renovation that tribes have been operating under was established in 1998 and focuses on the type of change, specifically whether it is a structural change or would significantly alter the facility. We've heard from many tribes that this definition is confusing and that there is inconsistent guidance for lead agencies and child care providers from the federal government about what is included and excluded. So we propose to change the definition of major renovation to be based on the cost of renovations for better clarity and consistent implementation. Specifically, we propose setting the threshold at $250,000 for child care centers and $25,000 for family child care homes, in recognition that costs will vary based on the size of the child care program, with annual adjustments based on inflation that will be posted on the Office of Child Care website. Any individual renovation or collective renovation less than these amounts would no longer be considered major renovation, and so tribes would not need to submit construction applications for approval by the Office of Child Care to use CCDF funds for these purposes. We are specifically seeking comment on whether these are appropriate thresholds for defining major renovation for the different types of care, and whether the definition should be annually adjusted to account for inflationary growth. Right now, this is just a proposal. Tribes should continue to request to use their CCDF funds for construction and major renovation under the existing definitions. We also propose to lengthen the liquidation period, so the time you have to spend the funds for tribal construction and major renovation funds, to give tribal lead agencies enough time to carry out construction and major renovation projects. Current regulations allow tribes to liquidate or spend construction and major renovation funds during the year of the award or the 2 years following the year of the award. So basically within 3 years. We've heard that the current period to spend construction funds is too short to properly account for the many years it can take to plan and execute construction successfully. Between federal fiscal year 2018 and fiscal year 2023, approximately 120 tribal lead agencies set aside a portion of their CCDF funds to construct or renovate childcare facilities in their service area, ultimately improving childcare services in tribal communities by building the supply of childcare in areas that lacked providers. While many tribes have successfully used CCDF funds to build or renovate childcare facilities, other tribes have been thwarted by the limited time available to spend those funds. We know that planning and completing successful construction and renovation projects requires many time-consuming steps, including engaging the community and hiring architects, engineers, contractors, early learning experts, and other professionals, and that there are many project requirements. We've also heard tribes have experienced many unexpected delays outside of the control of the tribal lead agency, and these have impacted the duration of projects. And these delays have forced some tribes to adjust the scope of their projects or to elect to use funds initially set aside for construction and major renovation projects for other CCDF purposes to meet the current liquidation deadline. This leaves much needed facility projects unfinished, resulting in unmet needs related to availability of childcare in tribal communities. So we are proposing to allow tribal lead agencies until the end of the 4th year following the year that the grant is awarded, so closer to 5 years, to liquidate funds for construction and major renovation, rather than the end of the 2nd year following the year that the grant is awarded as required by current regulations. And now I'll turn back to Ruth.
Thanks, Megan. So there are some proposals in the NPRM that only apply to states and territories. And I want to quickly highlight them here, just so we are clear on them. We have chosen to exempt tribal programs from these requirements because we don't think that they are appropriate for a variety of reasons. First, the NPRM requires states and territories to use some contracts and grants to pay for childcare. at least for some types of care that are particularly hard to find. Grants and contracts are one of the best ways to build supply and ensure parents have the full range of childcare options the law requires. However, it really is not feasible, is our understanding, for many of the smaller and medium-sized tribal grantees in the CCDF program, and most of the large tribal grantees already do this. So the NPRM proposal on grants and contracts does not apply to tribal CCDF programs. Second, the NPRM proposes to require states and territories to post additional information about CCDF sliding fee scales on their consumer education websites. This proposal also does not apply to tribes. Tribes are not subject to this. We're proposing to not make tribes subject to this requirement because already tribes are not required to have consumer education websites. So it's not a proposal that makes sense here and is not included in the NPRM. So that is the end of our overview of the proposed changes. There are other technical and smaller changes in the NPRM, and we encourage you to read it carefully. We think this NPRM will strengthen the CCDF program to better serve kids, families, childcare providers, and the communities. And if enacted, the Office of Child Care is prepared to work in partnership with tribal, states, and territory governments to implement these policies in thoughtful ways that account for the different childcare systems and the different needs of families across the country. Before turning it back to Megan to walk you through how to submit comments, I do want to touch on two additional areas. First, I want to assure you that we continue to hear your concerns about the background check provisions in the child care program. I know we all agree that background checks are important for ensuring child safety while in care, but we certainly have heard and understand that the law's specific provisions have been difficult and expensive to implement and may not always be the best way to ensure children's safety. While this NPRM does not directly address the background check concerns that you all have raised, I assure you there will be opportunities in the future for us to work together on this important issue. In addition, this NPRM does not address many of the concerns we've heard about the rules for the tribal CCDF program. We have a separate effort underway on that called a request for information, which is a formal process to gather your feedback, including through a formal consultation. I'm going to talk about that after Megan goes through the specifics about how to submit comments for the NPRM. But I just wanted to let you know that that is to come. First, I'm going to give it back to Megan to wrap up the discussion of the NPRM.
Thanks, Ruth. So first, I want to mention again that on July 20th, we will be hosting a virtual tribal consultation from 1 to 3 p.m. Eastern Time. You can register for the consultation at the link here. It's a bit.ly and it's OCC NPRM consultation at the end. We will also be accepting written testimony for 30 days following the consultation. And the testimony provided through consultation will be used to inform next steps related to our final rule. And as I mentioned with the final rule, looking ahead for discussing the regulatory and comment process as we go forward. As we mentioned, the NPRM was published yesterday in the Federal Register. This means the comment period has officially started. We will accept public comments until August 28th, 2023. There is only one comment period for NPRMs. So for those of you who may be more familiar with the Paperwork Reduction Act process, for example, when we publish the tribal plan preprint for comment, that usually has 2 comment periods. NPRMs are different and traditionally only have 1 comment period. Once the comment period closes, the Administration for Children and Families will review and analyze the public comments and use them to inform drafting a final regulation. We expect to publish a final rule in 2024. All comments on the NPRM must be submitted online through the e-rulemaking portal through regulations.gov. You can access the NPRM and portal for submitting comments through the different links we have in this slide. We also have the information on how to submit comments on the OCC website. It's included in the text of the NPRM, and we will be sharing these slides with you, so you will have them for reference for those links there as well. Public comments are a really important part of the regulatory process. When submitting comments, please make sure to identify the agency. So for this one, the Administration for Children and Families, and docket and/or RIN information so the comment gets to us. Also, clearly identify the issue you are commenting on. Including the page and column number and citation will help us better understand and respond to your comment in the final rule. The comments are also the opportunity for you to let us know where something isn't clear or where you have questions about something we have proposed. These points of clarification are very helpful for us and let us know where we need to clarify information in the final rule. Finally, we are continuing to create and post resources about the NPRM on the Office of Child Care website. Right now, there is a red line track changes version of the proposed changes to the regulatory language itself to make it a bit easier to track what we've proposed than what's in the back of an NPRM. A general overview of the NPRM and a fact sheet about how the NPRM affects tribal lead agencies. Several more resources, including a list of where we are asking for specific comment, will be going up shortly. And as I've mentioned, because the Office of Child Care cannot address questions not directly in the NPRM, we hope these resources will help as you review and comment. We encourage you to check back regularly throughout the comment process. And now I'll turn it back to Ruth.
Okay, so I'm going to switch to talking about this request for information, an RFI. We will soon be issuing it. I think you will see it in the next 2 or 3 weeks, I'm hoping. The RFI is specifically focused on the goal of broadly receiving input on childcare requirements, regulations, and processes for tribal nations that administer CCDF. The Office of Child Care will be using this process to seek public comment on whether existing CCDF requirements, regulations, and processes are appropriate for tribal nations to implement CCDF in a manner that best meets the needs of children, families, and providers in these communities, and that properly recognizes the principles of strong government-to-government relationships and tribal sovereignty. We will seek feedback on whether changes to rules and processes are needed to improve implementation and what those changes should be. So this is a separate but still formal process from the NPRM, and it will include a 2-day in-person consultation later this year. We've heard many concerns about the ways in which the current CCDF rules fail to meet the individual characteristic and needs of tribal nations and fail to properly account for tribal sovereignty. And so we're going to use this RFI to foster in-depth feedback on all aspects of the CCDF program, so its scope will be much more expansive than the NPRM. It's a little unusual to have an NPRM and an RFI out at the same time, so I want to walk through the differences between the two processes. First, the scope. The NPRM that we just discussed encompasses CCDF programs run by states, territories, and tribes. In contrast, the RFI we will be releasing soon really is just focused on the tribal CCDF program. Both the NPRM and the RFI get published in the Federal Register and solicit official public feedback through regulations.gov, and any member of the public is welcome to comment. Importantly, though, they have very, very different deadlines. The NPRM we just discussed has 45 days for the public to submit comment. But a key difference with the RFI is that we are able to provide a much longer time for comment, for public comment. We want to give tribal nations maximum time to consider the questions we're asking, to raise their concerns and propose solutions and ideas for the tribal CCDF program. So the public comment period for the RFI will go from the date it's published until the end of 2023. So a much longer period of time. We will also be holding formal tribal consultations for both the NPRM and RFI, but again, on very different timelines. The consultation, the tribal consultation for the NPRM is next Thursday, and it will be virtual. The consultation for the RFI, we are still finalizing the dates, and we will share them as soon as we have them, but we're planning on a 2-day in-person consultation for the RFI, probably in November. We also plan to hold more information listening sessions for the RFI through the fall. Another key difference between the NPRM and the RFI is, as Megan mentioned, with the NPRM, there are pretty strict rules about what conversations OCC is allowed to have with the public, including our grantees. And so we cannot answer any direct questions about the NPRM. On the other hand, the RFI does not have these same limitations, and we are allowed to have dialogue and answer questions. And so it allows for, I think, a much richer and deeper conversation, which we are really looking forward to. The NPRM, finally, as Megan just walked you through the process, after public comment ends, we take a look at all the comments and we work on issuing a final rule. The RFI is a little bit less specific on next steps, but the goal is to be collecting information that we can then use to inform future rulemaking. And then just a moment on previewing the content that will be in the RFI. So as I mentioned, we are really planning on an RFI that is broad in scope. We want to make sure that there's an opportunity to hear from you on all the various areas of the tribal child care program, and make sure that we have an opportunity to hear about the concerns or the challenges, as well as opportunities we might have in changing policy rules and regulations for the tribal program. So the RFI truly welcomes comment on any area of the tribal CCDF program, but specifically asks questions about funding policies, such as allocation sizes and what requirements should go with different allocation sizes, things like obligation and liquidation dates, spending requirements, the triennial child count and the definition of service area, things around eligibility, issues around reporting. All of these will be open to question, and we hope to solicit your feedback on ways in which our current rules are not working for you, and possible solutions on how we could develop rules that work better for tribal nations. And then just to conclude here on the RFI, I just wanted to give a sense of timeline. This is tentative, and basically things will get going once it actually is published in the Federal Register. As I mentioned, I am hopeful it will get published in the Federal Register by the end of this month, but it may sneak into early August. After that, we will be holding a virtual webinar, much like this one, to walk through all of the different pieces of the RFI, explain what the RFI is all about and what we're hoping to accomplish with it. We will be doing some informal listening sessions around the RFI through the fall. Then probably in November, that date is not final, but we will definitely be having an in-person tribal consultation for the RFI, with the idea that public comment would end at the end of this year. So we are hopeful that this timeline works better for tribal nations. One of the concerns we have heard from you is that oftentimes we do not give enough time for input There are a lot of things that affect how much time we are able to give. And so unfortunately with the NPRM, there is not a very, very long public comment period. There's a 45-day comment period. But for this RFI, we are aiming to design a process that gives the time necessary to really have the types of discussion and give you the opportunity to provide the feedback that you want to provide on the RFI. And so with that, we conclude our webinar today. I thank you very much for joining us. This webinar will be posted up on the website shortly, and we will be sending these slides around. We look forward to hearing from you. Public comment is a really, really important part of this process, and I hope to see many of you at the tribal consultation next week. So with that, have a lovely Friday and a good weekend. Thank you, everyone.